also in person, and will be filmed and recorded for live and subsequent broadcasts available through the Council's website. The Council is a data controller under the General Data Protection Regulations and the Data Protection Act 2018. We broadcast and record Council meetings to fulfil our public trust obligation to enable members of the public to observe the democratic process. Data collected during the process will be retained in accordance with Council published policies available through the Council's website. Members of the Council are reminded that they should follow the Council's established meeting protocols, including around the use of the chat facility, and the comments made in the chat facility are visible to all participants in the meeting, which may include members of the public who have also received invites to the meeting. So with that statement sorted, I'll hand over to Diane to take us through apologies, substitutions and declarations of interest.
We have apologies from Councillor Paisley with Councillor Curley substituting. We'll now move to a roll call before asking for declarations of interest. And the following members please indicate if they're present at the meeting either in person or remotely. Councillor Armstrong.
Present in the chamber.
Councillor Brennan.
Present in the chamber.
Councillor Brooks.
In chamber.
Councillor Cassidy.
Present remotely.
Councillor Curley.
Present in chamber.
Councillor Hillier.
Present in the chamber.
Councillor Jackson.
Present in chamber.
Councillor Law.
Present remotely.
Councillor McCabe.
Present remotely.
Provost Mackenzie.
In the chamber.
Councillor Robertson.
Present in the chamber.
Are there any declarations of interest?
Just to clarify, I set up my business, do a lot of work in the home centre. I've done it for a number of years now. If it closes, obviously, financial impact in my organisation. I don't appreciate that I'm not just to get out there. Okay.
Thanks very much for letting us know that. Councillor Jackson, I suppose the important thing, I'm sure Vicky will keep me right on this, is whether or not you've applied the objective test, and I suppose I'll check with Vicky about this.
I think you're fine. You're okay to stay in the chamber.
Okay.
Given that they're not, it's just for discussion for noting, there's no decision
Okay.
need to do.
Thanks very much, Vicky, and thanks very much, Councillor Jackson, and a very warm welcome to Councillor Hellier joining this panel. Thanks very much. So I'll just hand over right away to Craig to take us through the revenue and capital budget report. Thanks, Craig.
That's brilliant, thank you. Through yourself, convener. This is a standard finance paper that we bring forward every scrutiny plan cycle, and it covers a number of the main areas. It covers a period 7 projected 24-25 outcome position, current capital and the reserves position. As at period 7, we're currently projecting an overspend of £575,000 in the social care budget, and this is a £329,000 increase from the period 5 position. There are a number of over and underspends within the overall budget. The main driver for the total overspend is due to the Children and Families budget projecting a just shy of £4 million overspend, and this is mainly due to residential placements and child respite overspends at period 7. The service are currently doing a service review in this area. We plan to draw down smoothing reserves this year to assist with this position also. We also are having the use of the non-current pension ones to assist with the smoothing of the Children and Families budget, and the plan to use this to help us with our overall bottom line position. This is also partially offset by underspends in older persons, assessment and care and management underspends. If this overspend remains at year end, further use of smoothing reserves will be used to bring this position back to a break-even position. The next section highlights the HSCP's progress to date with the achievement of its in-year agreed savings, and as you can see in section 3.2.10, we've already made good progress in the delivery of our savings, and this will obviously continue into next year as well, because we set a 2-year budget. Moving on to the capital section, in section 4, it shows the current capital position. At this point, we're not showing significant spend to date. This is likely to be incurred at the end of the year, and especially into the next year for big projects such as the community capital project. Appendix 5 shows our overall earmarked reserves position, and it shows we started the year with 19.27 million and expect to finish the year at 12.66 million based on our current projections. As always, I appreciate this is a big paper with quite a lot of detail in it. Happy to take any questions any member might have.
Okay, thanks very much, Craig. I'll just have a wee scan. I don't see any lights on. I see one light on in the room, apologies, and then I'll just keep a check on one as well. So Councillor Curley and then Councillor Robertson next. Thank you.
Thank you, and apologies if this is a question that somebody's asked before and I'm substituting. Just a question related to the drawdown in the smoothing reserve. I'm just wondering, do we have an idea of, do you have an idea about how this smoothing reserve is going? Has there been a significant drawdown in the last few years, or has it actually been recharged at some points in time as well? Is it a smoothing reserve, or is it more of a one-way stream? Let's put it that way.
Okay, and previously I've convened this a bit, to be honest with you. And probably in the last few years, as the pressures have been down, we've been using it a wee bit more. But it depends on the particular year that we have. In prior years, we've had underspends within our overall budget, which we've actually used to replenish some of the smoothing reserves. So it is, as it says on the tin, it's for that particular purpose. But to answer your questions, in the last couple of years, we have been using it because of the potential increase in pressures that we've had in the children and families budget.
Okay, thank you.
Thanks very much for that response. Councillor Robertson.
Thank you. So my question is really relating to Appendix 1, the line item corporate director including business support, which I'm assuming is linked to 3.2.11 in the report, but I'm not kind of seeing them being exactly married up. I'm just wondering if you can help me understand what's happening in that line of that appendix. Okay.
The business support of the environment.
Yeah.
That is, as keeping the vast majority of, I would say, the non-recurring pension monies into it. That's our biggest amount, and that's where we're holding it at the moment.
So it's been held.
Yes.
Right, that makes it.
Thanks very much for asking that to clarify it. Okay, I don't see any other lights on in the room genuinely this time, and I don't see anything online. So if we can just agree as a panel to know the current projected capital position and the current reserve position. Thank you. That takes us on to agenda item 3, where we're going to go to Jonathan Hines to talk us through children and families placements. Thanks, Jonathan.
Thank you, convener, through yourself. Members of this panel who are also on the Integration Joint Board will have seen this paper at our previous IJB meeting, but it was important to bring it here today to give all.
So it was Susan, she's muted there. Thanks, Jonathan.
Thank you.
Apologies there.
So this report is an opportunity for all the scrutiny panel members to have an overview of placements for children and young people who require to be looked after away from home. And we felt it was important to bring this paper here, given that the overspend, as Craig has just articulated, is a significant cost pressure for the Health and Social Care Partnership. So the report sets out an analysis of how placements are sought, the oversight and governance arrangements, and also a summary of current work to address the demand and the inherent cost of placements as part of the wider redesign. As members are aware, the statutory role of social work is the protection from harm of the most vulnerable children, young people and adults in our communities. However, the majority of our activity in children and family social work is working with families around a range of issues and needs, seeking to really strengthen them, focused on principles of relational practice to improve outcomes. But there will always be times whenever children need to become looked after. And in Inverclyde, most children who are looked after either live at home with their family or with other family members in kinship care arrangements. but it will also at times be necessary for some children to be looked after away from home. And that decision will always be informed by a robust multi-agency assessment, and it can also be a legal requirement through the children's hearing system as well. So the report provides members with some more detail about how those plans are overseen by senior managers and subject to regular review. And also as head of service, I meet with managers and finance colleagues regularly to oversee those plans for children and to support the budget management around this area of service. We know that keeping children in their local communities is directly linked to better outcomes for them. It allows them to maintain their connections with school, with friends and family, and therefore a key part of our capacity is our own local foster carers registered within Inverclyde Council. They've been a fundamental part of so many children's stories over the years, and they continue to provide children with the opportunity to remain in loving, nurturing homes locally, but also to provide short-term placements as well as shorter-term or longer-term fostering arrangements. We also have a number of local foster carers who are registered with other external agencies, and we also have our 3 children's houses in Inverclyde, where up to 21 children live at any one time. But there will also be times whenever external residential placements for specialist needs will be required, either because of complex needs or secure care, as 2 examples. So the report at 3.9 gives a breakdown of types of placements for children at the moment, and it demonstrates also how that pattern has changed over the past 5 years through the course of the pandemic. But it does show that the majority of children who are looked after continue to remain either at home or with a kinship care. The budget pressures that we are familiar with around this plan will continue, and certainly at paragraph 3.10 of the report, it illustrates the notable increase in expenditure over the same 5-year period. Some of those costs will be incurred from those bespoke specialist high-cost placements for children with additional needs, but it also reflects changes in weekly costs charged by providers. We also have seen cross-country actually the legislative framework for children and family social work changing, and over the last 10 years we've seen continuing care and aftercare provision within the legislation, and that means that children who are looked after can continue in their placement according to specifics of the legislation up to the age of 21 for continuing care, or up to the age of 26 for aftercare services. And in effect, that reduces our local capacity, where we've got some foster carers who have retired, but also some young people who continue in their foster care placements or to continue living in our children's houses as well. So we have, whilst that's a positive outcome, it also reduces the local capacity for other children who may require to be looked after away from home. A particular challenge, I suppose, around the whole focus on placements and residential placements as well is the fact that within that landscape of continuing care, the legislation places that requirement on us to provide that support, but it's not matched with a financial provision from Scottish Government, and it means that the majority of those costs have to be met within our existing financial provision. So we are undertaking a bit more analysis around continuing care at the moment. Initial indications suggest that the cost of continuing care and supporting young people who meet that criteria is around 3.5 million. So it represents quite a significant proportion of the overall overspend we've heard about already today. We have looked within the paper at comparable data with other areas as part of our benchmarking arrangements. And it's reassuring, I think, on one hand, to see that the average weekly cost of a placement for Inverclyde children is lower than in comparator areas and aligns closely with the national picture. We have been working over the past year, nevertheless, on the primary overspend around external residential placements. And the team have worked with our finance colleagues, and we have projected a reduction to year end of around £570,000 on the full year projection, although that figure will always change based on the week to week variances and the demand for placements, which is demand led and can't be fully predicted. But the focus around our redesign is clearly not just about the budget burden that external placements represents, but it's always based on the best outcomes for our children and young people in Inverclyde. And as part of that, we're keen to expand the number of local fostering households. So the team are working with some of our existing foster carers and also some other comms partners to develop a targeted recruitment campaign this year to really try and expand that local capacity. We're also investing in evidence-based programmes and interventions such as signs of safety and healing, and we've commenced training for our full staff group and our partners, and that will take place over the next couple of years, and that's really providing a stronger framework for assessment and risk management around children who are at risk of harm. But we're also looking at how we develop our supports to our older young people, and members will have heard before about the LENS project and the development of the practice pad as one example to support our young people towards moving on towards independent living as well. So in conclusion, the increased demand for care placements reflects the significant level of vulnerability in Inverclyde that persists within our communities, but really we're trying to shift the focus of the service towards that earlier help and intensive family support, as well as investing in those evidence-based programmes and the intensive supports for young people. It is hoped over time that we will see that balance of care shift, but clearly it will be a long-term change, not just in our practice, but also in terms of trying to invest and spend greater time at an earlier opportunity with families to reduce the need for children that can be looked after in the future. Thank you, Convener. Happy for your comments.
Thanks so much for that, Jonathan. That was really full, and I think members of this panel, this is all elected members, really take our roles as corporate parents very seriously, and we do want those best outcomes. So we really appreciate you keeping us informed of this process as you have been, I think, for some time now, and this is really good to hear about this next stage, and we'll be watching, I think, with a keen eye to see what's happening with the next step. So thanks very much for that. I'll go to Councillor Brooks first.
Yeah, thanks very much. I associate myself to thanks. It's really good to get that update. But you started to talk on the continuing care 3.5 million estimate, obviously rough figures, and you moved on to comparatives. And I thought you were going to give us comparatives on continuous care. You didn't give any comparatives on cost, obviously. So I just wonder, is other local authorities, the other 31, having challenges similar to us with this, or in comparative local authorities, are they having that 3.5 as their figure, and they'll have different figures if they have the same challenges?
Through yourself, Convener, thank you, Councillor Brooks. I have been in touch within recent days, actually, with other chief social work officers in the west of Scotland who are beginning to come back to me with some anecdotal information about their own circumstances. So it's early to say, but through the work that we're doing, that we've just commenced to do that deeper dive around continuing care, we'll gather a better picture, not just of the implications for Inverclyde over the next 3 years and the expected demand and the cost pressures there, also to work collaboratively with their other colleagues in neighbouring local authorities to better understand their own financial arrangements, but also how they're seeking to mitigate the impact of the
Yeah, that's helpful. So at a future date, we'll be able to hear that story. Because I'm just thinking, Convener, if we're all local authorities have these challenges, if the continued care funding has not been supported by Scottish Government, then maybe that's a picture that we could see, and obviously our voice could be heard going into Edinburgh if that's the data that we receive from other local authorities.
Yeah, thanks very much for that, Councillor Brooks, because it's certainly a very clear message, I think, coming through, and it's worth just putting down a note, I think, to get that response from Jonathan, certainly, and keep a really close eye on it ourselves and see what actions we want to take. I think that's a really good suggestion. Councillor Armstrong and then Councillor Hellier, thanks.
Thanks, Convener. I'm looking at the table in 3.10. and particularly foster care external. I mean, obviously the costs have gone up, really, really high, huge. There are just short of 60 fostering organisations in Scotland. 32 local authorities and some of the big voluntary trusted organisations, Barnardo's, Aberlour and so on. There are about 15 roughly 15 independents, and some of those do have charitable status. And I really want to ask, in the £578,000 that they're spending, are there organisations that are frankly private equity firms in there? There are well-known independent fostering organisations that are owned by private equity firms, and I understand how difficult it is because of possible identifying information, but I think it's also important that this panel understands where some of this money could be going. So that really is my question. Thank you.
So, without getting into the detail, and everything's here, and you'll find that in your the exemption report, you might get some of that level of detail already because we will have contracts. So I don't want to elaborate, but it's demand-led. Councillor Armstrong, and actually, when a child needs to come into care, it's usually because of significant harm. And we would not necessarily, it would be about who the foster carer was, what the right placement was, the location of it, the access to birth parents and schools. So we will always make our decision around the needs of the child as opposed to the organisation. But there will be, we're happy to take that but the next bit of the discussion of what you've asked, and because it will be in within the Centre's report, because of the contracts in. Okay.
Thank you. I mean, I'm aware that the Welsh Government has made commendable efforts to stop using the organisations that are private equity companies, and had a bill, but it's like other attempts to improve care services. It's gone into the long grass because, frankly, a lot of opposition, but also there would be many disrupted placements, and that's where it's gone. They're still hoping to progress their bill that will stop new registrations of such organisations. My worry about that is that the existing registered ones will just expand; they'll just get bigger. And I have very serious concerns about these organisations because I don't believe that a lot of their functioning is based on the best interests of the child. If you look at whistleblowers and so on, they will talk about they will say that these organisations refer to foster carers as gold bars. They refer to children as units. It is and if you only have to look at their website, quick look at their website, and you will see it's all about money. It's all about payments and money. It's not about why you might want to help a child or children. And at the end of the day, for them, it's about heads on beds. It's not about family reunification because that doesn't pay them. I'm sorry, so I am, I think it's a legitimate concern of this panel, and I'm very well aware this is not just a local issue. It's a national issue, and it's a UK issue. I've been referring to the attempts of the Welsh Government, but I think it is incumbent in this scrutiny panel to know where some of that money is going. And Polaris, for example, they're owned by what they call them Cap Vest, and in 23 they made 14.1 million pounds profit. That's where some of this money could be going, and I think we have to know that. I know that we're making assessments on the best interest of the child, but I think where that money ultimately goes is also a concern.
Right.
Thank you
very much, Councillor Armstrong. I think Kate wants to come back in, and then I'll go to Councillor.
So, if the promise and the chair of the promise board, which is an independent board, and the promise, you'll be aware that is of a concern for Scottish Government and across the system about the industry that has developed elsewhere in the back of, and particularly in England for a long time, and then in Scotland. So there is a commitment to ensure that it's that there's no profits for children, and I would embrace that. But in saying that, it is demand led. So if anyone in organisations required to be registered with the care inspector, so it's not within anyone's gift around this table to decide how we manage that. It would be around the care inspector. And what we know is that coming out of the pandemic, because of the shortage of resources within local authorities, either for foster carers or around the budget, to be honest with you, children's services, we are seeing companies coming into that space. And it's a real dilemma, because at the end of the day, we have to safeguard children over profit, okay? And we have to live with the imperfectness of the world that we currently inhabit. But it was just to come back and say, I sit on the Promise Board, COSLA's Promise Board, as a chief officer, a health and social care partnership, and it's one that is being, as well as Scotland Excel in the joint improvement team, and it is something that is talked about quite a lot, but there's no solution as we stand until we strengthen services for children across the country and understanding the impact of the pandemic. We're just going to be, we're constantly on a hamster's wheel, quite frankly, you know.
Thanks very much, and I really appreciate the answer. Thank you.
I think that's really useful to get that insight from yourself, Kate, as well, at that national level, that it is a sort of area of national concern that you're raising, and something that I think the officers are very much aware of, but very much looking at local activity here to see what we can do to improve things here, right here in Inverclyde, as part of the redesign. Councillor Curley?
I think it was.
Councillor Haley first. Yeah, okay, that's very good. Thanks.
Thanks very much. Thanks, Chris. Yeah, good afternoon. I'm just thinking on the report of the foster carers, and I was listening nationally that there's a bit of a problem now with the retention and recruitment of foster carers, and I was just interested to see how that's affecting us locally. And we also suffer from that. I believe it's now an aging population where people are moving on, and we now need to recruit and retain. Is that a difficulty, and do we have sort of plans in force to overcome that, or is it still a problem that's difficult to get a solution for?
Thanks, Councillor Haley. Jonathan?
Thank you. Through you. I think it's fair to say, Councillor Haley, that in Inverclyde we are seeing a similar pattern, or have seen a similar pattern over recent years as the national picture. I suppose through the pandemic, foster carers, particularly foster carers who would have used to providing shorter term placements, found themselves in quite a different situation, particularly when we were in the eye of the storm around COVID-19. And then coming through that, as a number of people did for different reasons, some foster carers took the opportunity to retire or to step back and change the criteria of their registration as foster carers, just looking at their own priorities, completely understandably. We have seen in Inverclyde a really dedicated core group of foster carers who have been providing foster care placements for many, many years. And of course, with that profile of foster carers, we have seen a significant number, a scale proportion, who have retired. So we've got the perfect storm running through a reduced number of foster care households and the high demand that we've seen over the last 5 years. And really that's why we're looking at trying to develop a more targeted but a more dynamic campaign to encourage more people to become foster carers for children, but also longer term looking at supportive carers, which is really similar sort of home environment for older young people as well. So we are looking with some agencies potentially who can support us with that around the CON strategy to make it as effective as possible, because we know that from experience in other parts of the country and locally, if it's quite a generic campaign, the return can be really minimal. And I suppose it's about what motivates people to think about becoming foster carers in the first place. One of the challenges about retention that we see nationally as well is the need to have short breaks carers. So where foster carers may benefit and children in their care may benefit from what would be called respite placements and no money, but essentially short breaks, foster carers who can provide that bit of space and respite for the longer term foster carers and children as well. So there is activity being planned at the moment. It's something we want to get right in Inverclyde. But again, the strengths of our communities mean that we would be hopeful that we will see some respite carers coming on board, but it will always be a small number for many of those activities around trying to recruit additional foster carers. What we have to offset that, I suppose, just in closing my response to your first question, seems some very creative approaches to kinship care locally as well, not always driven by extended family members, but looking at other trusted adults who have an established relationship with particular children and where they've been able to really step up and be assessed at short notice to provide an appropriate kinship care household for children as well. And again, that shows the creative approaches of our teams, but also the willingness to be socially focused, I suppose, in terms of our communities as well.
Thanks, Jonathan.
Thank you, Jonathan.
I think I had the privilege of getting along to some of the foster carers and young people's Halloween party, and I think apart from anything else, I think it was really clear at that party seeing the relationships that the foster carers that we do have had with our senior officers and with a lot of the social work staff too, that you could see how closely they were working together. But certainly the recruitment of foster carers, including maybe respite carers and seeing those early interventions, is something that I think we will be keen to see coming through, and we know that Jonathan and the teams are working away on that. Councillor Curley.
Yeah, thank you. I'm just trying to get my head around the numbers here, and I can understand completely there's a significant cost increase because of the external residential fostering expenditure. And as I say, I'm not usually on this committee, so the numbers are rather stark to myself. But I'm just trying to get, and I'm conscious of the fact this is a noting paper as such, but see when it talks about the average weekly cost per child per week, the improvement service, I take it that's average over all care and not just the external care, because looking at the numbers, it would appear that the foster care external is up about, I'm conscious of the fact I'm working numbers off, is about £30,000. And the residential care external is significantly above that again. So that's maybe £300,000. So that's the kind of levels of we're talking about.
Yeah, so each local authority does a class return every year, and where they look at the average cost for a child in placement based on the community, based on foster care, and based on residential. So what it can cost to keep children in the community is much more, is better outcomes for children, for children first, and then more likely to be much more cost effective. And so that is part of the work that Jonathan and his team are trying to do, to think about what else can we do within Inverclyde to keep the children in Inverclyde. We have one of the best outcomes for children that are looked after in Inverclyde in terms of our education. And you know, we have probably one of the highest in terms of the attainment challenge. So it's within a wish to keep irrespective of the cost around it. But it's a very tricky place because there's 32 local authorities competing for each other for placements, even if in the external sector. So it's demand led, but it's also led by the independent and charitable sector deciding around that child, and it's a very challenging agenda coming out of the pandemic. And it's not without any surprise to any of us, because, you know, children and their families need to be part of a community and education, and we're at home for nearly 2 years. So the impact that it's had, particularly for children who are very vulnerable, but particularly for neurodiversity, is quite significant. So it is going to be a challenge for us moving ahead, and it's not something that you can fix quickly.
And it's just for me, just coming to the bit, it's just the startness of the numbers. It's something I have missed as a corporate parent, which maybe should be more aware of. But the amount of, and it's good to see that kind of level of investment in our children who need it the most. But it's making sure we get it right. I'm just conscious. I'm very pleased to hear what you're saying about getting it local and trying to get the most appropriate care for our young people. But yes, the level of cost that's going external to Inverclyde and maybe, as Councillor Armstrong suggests, maybe being going to companies who profit more, then it's just to try and see how we can get that balance right. So, but I found that the figures very stark and just come out of the page at you.
And can I say that's an underestimation around it, because sometimes children require even more support within external. So that's a moderate £300,000.
There'll be
Yes,
there'll
absolutely.
be a spread on that, even that number. That's an average of an average.
Yeah. Thanks for that, Councillor Curley. I'm sure, not to put words in the wind's mouth, that's one of the reasons why Councillor Brooks made the point that he did earlier on, because looking at continuing care as well, which is absolutely the right thing to do, but it's a great, essentially a very good policy, very important, but the money's not quite there for it, and obviously we are very used at this panel. I think Craig talks us through these figures regularly, and so we're used to seeing these amounts, that we know how much it certainly does cost.
Sorry, can you just back on at that point? I'm sorry. Yes, I just on that. I'd be interested because I'm very conscious of the fact that this is an often paper and this analysis, but do we have numbers on the actual cost for the continuing care and the level of support people in continuing care actually require? Because obviously, if you're looking at somebody going into 21 and then up to 26, you'd be hoping that the actual level of care would actually be able to taper off, because you want to get people into a sustainable position. So I'm presuming that kind of numbers are available.
So children up, continuing care, residential, and the right to stay only applies up to 21, and then from 21 to 26. Now there's margins, because some 21-year-olds, even though that is continuing care, might not be ready, and the risk might be too high for them to move on. So that would be an assessment for the social worker. So 21 to 26, it's about the support that we provide them in terms of resettlement, for want of a better word, settling back in, re-establishing, particularly if they've been in an external placement, or settling them in the area that they might be in placement. We have 48 young people that are between the ages of 18 and 21 subject to continuing care. So that's in the main, maybe not as high costs as a previous discussion, but quite significant, because some of them will be in external placements, some will have been there for a long, long time, and it would be difficult, and they may well not want to return. And obviously it's enshrined in principle primary legislation, the right to stay. And it hasn't been funded. There has been small funding coming in at the very beginning, and it hasn't been funded, and there'll be a variety of responses that each local authority will have done to mitigate the impact, and that's what we're interested as well. So that's part of the work that we would report back about what other local authorities have done in this space, because there'll be much bigger local authorities than us that'll have that experience. But we're really pleased that 48 Councillor Armstrong will tell you, these young people didn't keep in contact. We're also very pleased that the vast majority of our kids that are in the aftercare, I think our stats are about up in the 90s that they still keep in contact with us. And if we keep in contact with them, we keep them safe. And these are the many young people that end up in the homelessness, addictions and criminal justice system. So it's going the right way. It's just that it's a challenge financially.
I suppose go back to the cost, and I do apologise.
I think I'm aware that Councillor Jackson has been waiting so
Sorry.
Councillor Curley, so
It's just last bit. I suppose the thing is about the cost is that you're actually spending money on the children as opposed to trying to deal with the symptoms later on. So that's the sort of that aspect of it. I do apologise, and thank you for your time.
Yeah, that's aye, thanks for that, Chris. Sorry, thanks very much for your patience, Councillor Jackson.
It's just a quick point, obviously it's on the after 3.9. It does say that case by case seems demand led, and it does seem in draft that the demand is primarily the impact of the pandemic. Is that probably to say, Jonathan? Because it's only a 5-year timeline there. Maybe if it a 10-year timeline, it would have been more obvious to us. But it's just, it does seem obvious that these pressures will become pandemic, and I imagine the external companies a space to say cost else between the wages, factors that we've got to factor into well. It comes to the figures of its price start between 2019 up to 2024. I just wonder if there any information can add to that, why these costs are so steep. Is it on external pressure? Is the case it's demand led? I'm very quite rightly why they do it. These money going, and it's all kind of as it's sort of aligned.
Thanks, Councillor Jackson. Jonathan?
Thank you, Convener, through yourself. I think it's fair to say, Councillor Jackson, that the impact of the pandemic, we know that the ripple effects of the pandemic continue to affect our communities in various ways, and we see that through the profile of need and the profile of risk right across social work services. So I suppose our most vulnerable children and families were already at a significant disadvantage, and the impact of the pandemic has a longer tail for them, I suppose, if we were charting that. The reason why within this report we went back to 2018-19 was really to get a full year comparison pre-pandemic and then to chart that through, where so often with a lot of our data around the pandemic we see it go up and then we see a lot of the indicators return to pre-pandemic levels, and yet here, as you rightly point out, we've just seen an exponential increase in cost. So some of that is about increased numbers of children and families requiring a range of interventions. Some of it is about complexity. Some of it, I have no doubt, is inextricably linked, particularly in an area like Inverclyde, to the impact of the cost of living as well, and a number of the other factors that we're all very familiar with around this table as well. So I think it's that combination of vulnerability and complexity that has really pushed those figures up. I suppose if I was to look at the graph above, the little bar chart above, it's still reassuring to me as a social worker that the majority of children are looked after at home, where we are continuing to provide support to families and interventions within the child's family home or within kinship care. So from a numbers point of view, the majority of our children who are looked after within that family setting. But you're absolutely right that the cost pressure as an indicator of demand and increasing demand is reflected in that significant increase in the external residential and foster care costs over 5 years.
Just one of the questions on the kinship care. Is this a consistent figure over a number of years, Jonathan? This 56. It's quite a large number there of kids in kinship. Is that up, down, is it average over a period of time?
Thank you, through yourself again, Convener. The figures within figure 2 are the annual kinship care numbers, but what we're seeing within our own kinship panel is, and that's really what the panel that has oversight of our kinship carers in terms of assessment and support to kinship carers over the course of the year, and where we identify their own development needs and other supports. We're seeing the numbers of kinship carers, I suppose, over that 5-year period and into this year increase. It's not a significant increase, but it's a continuing pattern, and it's a pattern that we would be keen to see continue, because again, as Kate said, and other members of this panel around the table today have recognised children remaining within a family setting and remaining in the local area has a direct positive impact on the likely positive outcomes for them as adulthood. So again, the numbers of kinship carers are relatively stable but marginally increasing.
Okay,
thank you.
Okay, thanks so much, Jonathan, for responding to that full discussion and really appreciate everybody's input there, because I think, as I was saying, as corporate, I think that's only what we'd expect, is for us to give sort of a full, respectful questioning there, and also to see somebody absolutely making the most of their substitutes privilege at the same time, which is always very, very well and very well. We'd expect nothing less. So we'll just give a panel to note the contents of that report.
Great.
Yeah, thank you. And move on to item 4. Thanks very much to Maxine for joining us for this. It's homelessness, new model of behaviour support, and again, think very welcome update here to this panel on that subject. Thanks, Maxine.
Thank you. So the report outlines a proposal approved by the Inverclyde Integration Joint Board to redesign local homelessness services, and it includes the decommissioning of the Inverclyde Centre and a review of the staffing model. Some of the key points throughout the report links to various strategic plans and highlights the needs for improvements in housing and homelessness services. The actions include transforming the temporary accommodation model, delivering wraparound support and developing a collaborative housing options model. In terms of our local context, homelessness in Inverclyde follows the national upwards trends in terms of homelessness applications. The current model includes temporary furnished flats and the Inverclyde Centre, which faces challenges, not to mention high staff absences rates and additional costs due to agency staff. The case for change really focuses on early intervention and prevention opportunities to reduce repeat cycles of homelessness and opportunities for a whole system approach to improve outcomes for people. The paper that was presented to the IJB presented 3 options, and option 3, which included decommissioning the Inverclyde Centre and reviewing the staffing model, was approved. This option aims to reduce the financial overspend and improve service delivery through a whole system approach. So similar to the previous paper that Jonathan has presented, whilst we have a clear responsibility to manage the financial implications of any service that we deliver, our primary focus has to be on outcomes for people. So the review of the staffing model will address current issues such as high staff absence rate and reliance on agency staff, and improving the overall quality of care and support. I have to say that we are currently in the process of quite a significant piece of work in terms of a staff consultation programme, and I'm absolutely delighted to say that that is going really well and really positively, with the staff so really well engaged throughout that process. The shift from an institutional setting to a community-based support model is expected to lead to better health and social outcomes for homeless individuals. The redesigned service will emphasise early intervention to prevent homelessness and reduce repeat cycles. People will receive tailored support to help them achieve and sustain tenancies. The new model will focus on delivering wraparound support, addressing multiple disadvantages such as mental health and substance misuse, and aims to provide a more stable and community-based living environment. Overall, the changes are designed to provide more effective and sustainable support for homeless individuals, helping them transition to stable housing and improve their overall well-being. I'm happy to take any questions.
Okay, thanks so much for that, Maxine. Councillor Brooks.
Yeah, thanks very much. So welcome, and obviously I'm glad the IGB made that decision, because I think it's a fantastic and the right decision to make. I've got 2 questions on it. One is from my head, from sort of the bigger point of view, with sits on my shoulders. Who owns the Inverclyde Centre? When the asset comes down, who will the land refer to as IGB, or is it council? Where does the land go? And who pays for the demolition? And secondly, obviously, doing the staff consultations is correctly the right thing to do. I know there's a number of staff pressures. Through some casework, I'm aware of ex-members of staff who left under various reasons. There may have been an ex-interview. Is there any chance, some of them are still employed by the council, is there any chance we can pick up ex-staff so we can understand the challenges they had and sometimes the reason they walked away?
So I'm going to let Kate answer the first part of that, because she's been around longer than I have, if that's all right.
Yeah, just a bit. Seems like a in a possible way. I just want to qualify that. It's Inverclyde Council that owns the building.
Okay.
So the demolition, and I don't even want to say that word because I don't really know what the outcome. That would be Stuart's responsibility. So I've already had discussions. So he will feature in some of the decommissioning timeline for that. So
thanks. And the ex-staff?
Yeah, so the consultation programme just now is going really well. Couldn't have wished for that to go any better, and because we're all on the same page from the very outset, you know, and that was a worry that we would all be off in different directions. Really pleased to say that we're all on the same page around that early intervention and prevention. So just in case you're not aware, I've been around since September in this role. So if HR hold those exit interview papers, if HR are doing them, I'm absolutely quite happy to go to HR, have a look at them. I actually almost feel like I can predict that they will say the same things because we did a staff survey, and there was nothing surprising in that staff survey when we took that out in the first place. We followed that on with some focus groups, and then we've got some workshops planned in the next couple of weeks. Nothing is a surprise to me in terms of what's coming out of there. But if that offers additional reassurance, then I'm more than happy to go back to HR and ask if there's some exit interviews that we can have a look at. Thank you.
That's clear.
Yeah, thanks very much, Maxine, for that. Councillor Robertson.
Thanks, Kavina. The question that I've got is well, first of all, well, it's not even a question. First of all, it's to completely agree with Graham in terms of this is a great decision to decommission the Reclaim Centre and do things differently. I believe very much in the housing first model, that we give people the dignity of a house and then we help them to sustain an tenancy rather than going through several hoops first to get the basic thing of a house. The question that I've got is about the future of temporary accommodation and what that means in Inverclyde. And then really I kind of want to take it almost from a journey of a person, if that's okay. You know, if a person is in a homeless context and they are put in a temporary housing situation and then they sustain that, surely it's more of a risk to then have them move somewhere else once they're sustaining a tenancy. And if we're changing the whole game here, is there a way, or are we already thinking, maybe you're already thinking about this and I'm just tuning in, but you know, to can almost see if someone is in a house and sustaining it, let them stay until they choose to go for whatever reason, rather than saying this is the temporary accommodation that we have, you've been there for a while, now we need to free that temporary accommodation up for someone else to live in it, and thereby breaking their sustainability. It's just a bit of fear that was kicking about my head, and I wanted to kind of get some reassurances on it.
Because we're doing all that already, okay, so just to reassure you. And actually one of the things that we're keen on doing, looking at that model elsewhere, is that for the community of person, people have made this really good established relationships with neighbours. It provides that level of reassurance to neighbours.
Yeah.
So certainly that is going to be a feature, but it will come with some costs too, because we'll have to create a new tenancy and start from scratch with, you know, what that looks like and the cost of the tenancies. But to be fair, the team has started to do that already.
So obviously we've got our housing partners who certainly need to be involved in that as well, and is there a way for us to kind of go, that's almost no longer a temporary you know, flat for us, and here's another one that can come on stream to make sure that we've always got capacity at the front end.
Can I just say that River Clyde Homes have been an exceptional partner in this, and have made a commitment to work with us to do what's best by people. They understand that it's not just about flipping tenants, if I hate that word, okay, or the churning, that they will look at it in a much more person-centred approach. And I appreciate that Maxine's only a few months in post, but very quickly has established the good working relationship that has been developed, you know, for at least the last year, and ensuring that they will help us to be part of that, and they have made a commitment that they will prioritise the health and social care partnerships because of they've got statutory responsibility to that, but there is an actual willingness there to do that. I don't know if you want to say anything from the fact that you're new and you've, without me kind of embellishing it too much.
I don't feel that new anymore, but yeah, so the we're doing some really good work just now around, so we talked about that early intervention and prevention. So, you know, in an ideal world, if we get that right, then we have a handful of people who are coming through that temporary accommodation homelessness model, if we get that right. So we talk about shifting the balance of care. For us, that's about shifting our resource up to upstream to make sure that we're preventing and reducing the opportunities for people to become homeless, to provide that support really early on. We talk about sustaining tenancies. We need to sustain tenancies before people become homeless. What we are seeing with our relationships with the likes of River Clyde Homes, and I'm glad Kate pulled that forward, because I have felt really supported in this journey moving through this whole redesign from all of the RSLs, but particularly being the biggest one, River Clyde Homes. We're on the same page around some of this, so I'm really pleased around that. And what we've actually seen is, and I know we don't like the terminology, but people use it, flipping properties. What we have seen is it's not about us going to RSLs to say, can we, somebody's in this temporary accommodation, they're settled really well, can we flip it? They know that tenant well enough that they are coming to us to say, we don't see the point in moving this person on. Can we? So we're seeing that really proactive response from our RSLs as well. I've literally just before here came out of our annual meeting with the Scottish Housing Regulators, and it's been a really positive meeting. There's stuff that we need to make improvements on, but we know all that already, the stuff that we need to make improvements. It's always good to know what you need to make improvements on and not for it to be a surprise. But so we've been talking through some of the data and our performance around that. And actually we are leaps ahead in terms of the national picture around how quickly we support people through that assessment process and how quickly we get people to a permanent destination, if you like, to a permanent solution to their problems. So we're starting from a really good place. So we've got staff consultation, we're all on the same page, tick. You know, we've got some really good assessment data in terms of how quickly we move people through that process. So we've got lots of positive things, and we've got an excellent relationship with our RSLs. So there are risks in terms of moving to that new model, but actually I would be more concerned if those positive things were got were our risks rather than the risks that we do have, if that makes sense.
Thank you.
Thanks.
Apologies,
So
for
much
the
for that,
intervention,
Matthew.
just a wee declaration. I'm a River Clyde Homes board member. As it's been brought up, I'll declare that I've got no reason to leave the chair.
Great. Thanks so much for that, really, for the response to that. Thanks, Leah.
Yeah, thanks, Sabina. Yeah, I mean, well overdue. The decommissioning of the River sectors, I will remember previous job. In fact, somebody once tried to stop us entering the building, and that didn't go well. So obviously a lot of information there. I'm really concerned now from when they move on and they're vulnerable, do they become an individual or they're still treated as part of a team that's going to be addressing their vulnerabilities? And how long will that last for? So if they move into, say, a house on their own, how long will they stay there and how long will they be given support to almost retrain them back into living themselves?
Thanks, Maxine.
So it's based on individual needs and individual circumstances, so however long a person needs. So if we look at our broader strategic plan around, you know, creating independence, moving people on to independence quicker, then absolutely we want to move people on to those levels of independence as quickly as possible. There are people who will need more support and there are people who will need less support. So it's very much a tiered sort of programme of support. And if we get it right in terms of how we redesign our delivery model, then we will be able to create that level of expertise for the really complex people that need that support. But there are also people out there who we were supporting that would benefit from other types of support in terms of that community engagement type support. But in answer to your question, I think the report's clear about wraparound support, and that is what we are absolutely committed to, depending on the needs of the individual. So we move people through that process as quickly as possible, but it would not be to the detriment of, you know, so the Scottish Housing Regulator looks at our performance in terms of how quickly we get people from to settled accommodation, if you like. We need to not be driven by that data and the performance. We need to be driven by how well somebody copes with the process of moving through that. So it varies, but just to offer the reassurance that it would be wraparound support dependent on needs.
Yeah, no, that's great. That is reassuring. Thanks, Maxine. Councillor Jackson.
Let everybody else have my share on this. In the first of 5, it's always been really successful in reducing drug use, and there's always mental health issues are all here in the hills. The question I have is, there will be people out there who are not ready to take a tenancy. I know a couple that have tried to take a tenancy within my ward, and they did even last 6 months because we're in a chaotic lifestyle. What's the plan when we close the home centre? What's the plan for these people who are not ready to take that tenancy? Where will they go? How will we support them?
So I've seen a lot of innovation across Scotland around digital opportunities. So many opportunities where examples of people who were having 15 hours of support a day. Through digital supports, we are able to maintain somebody's dignity in terms of their independence and a lack of intrusion on their rights, if you like. So there's some real opportunities for here to look at those digital opportunities to support people in their own homes. And actually, I've seen some real examples of the type of people that you describe actually managing very well with that, because often when somebody has got that level of complexity around mental health, perhaps substance use, etc., then actually the one thing that might be the thing that creates more challenges is having somebody in their house and in their face all the time, if you like. So allowing them to be in control of how they manage their support through digital opportunities. So there are lots of opportunities. There will always be those individuals who we really struggle to get it right for, and we don't shy away from that. But again, I'm really clear that from what I've seen in Inverclyde, that those people who are the most complex, then what our culture in Inverclyde has been is that we will create a bespoke service around that person's needs, if you like. So, but I would assume that the majority of the people we support will benefit from the service that we're redesigning, but we would, deliver that bespoke service when that's needed.
Yeah, okay. Thanks so much, Councillor Curley.
Get worried.
One Anyhow.
I think it would be a question and then a sort of follow-up. Councillor Curley.
No, it's my question is, I think I was right interested in this previous one, so I thank you for indulging me. On this particular thing, I was just picking up something you said about the RSLs coming forward and being proactive about, can we change this tenancy? And I think that's good, because I think it's building that relationship between the RSL and the tenant. But I'm just wondering, is there barriers to that approach, depending, is there specific quotas that each RSL have to provide? And say, for instance, if an RSL didn't have another house, that might not necessarily be able to happen. I'm just wondering if is there a degree of flexibility about that, or they say, well, actually you can't inverted commas flip that house because then we wouldn't have another house and we need to provide a certain number of houses. So just with a bit of clarification about that.
So the short answer is there's flexibility in that. I think what we are trying to work towards with the RSLs is an agreed number of temporary accommodations. In order for us to do a bit of future planning and forward planning, we need to be able to have a sense of what the resource and the capacity available is. But there is absolutely flexibility in that. It does come at a cost. I think Kate mentioned that, it does come at a cost to us, but the financial cost, the outcomes cost far outweighs the financial cost. We get much better outcomes for people. So we need to think about it. And it's quite a complex picture, because where we have the temporary accommodations and where people are looking for temporary and permanent accommodations is obviously quite mismatched. So when we give up one temporary accommodation and replace that with a permanent one, we do have to replace that again. So it is dependent on sort of turnover in communities and the needs of the people coming through. So we don't have a lot of families or large group families coming through. So we're generally not pressured around being able to provide the right type of accommodation. So, but it does present some challenges. But the benefits far outweigh the challenges that of that. Does that make sense?
Yep.
And just to add in that, part of us doing the review, we did bring in some expertise from the City of Glasgow, the closed Peter McCann House, for people that are familiar with it in the old hostel provision. And we have really not enacted our statutory provision through the Health and Social Care Partnership in terms of the housing contribution statement to get the priority over tenancies. So in other local authorities, they provide an expectation, the RSLs, at the beginning of the year of what tenancies they will deliver to us, okay, based on demand and need. We don't believe we need to do that, but that provision is there for us to do that because we've got into a really good place with the relationships. But the RSLs are aware that we could do that if required, and ensuring that we get the tenancies. So in some ways we're safeguarded because of the primary legislation that's sitting in housing. And I think we went, because none of us are experts and we're all learning to become much more knowledgeable in this space, etc. And we were really pleased that we got that level of advice, and it's something that we would think about, but we don't think we need to do it.
Thank you.
Thanks so much. I think as we can tell, I think the progress is really welcome in this forum, and I'm sure in lots of the people you're speaking to about it, it's really positive step forward. And I think in these questions and your responses, I think will have given us all a lot of reassurance and confidence about what's happening in the consultation. That it's not just better for the people who need the support in terms of housing, but also for the workforce too, which is equally positive. So I think all that remains for us is just to thank you for all the work that you're doing and note the content of the paper and note the decisions that have been made at the IG. Thank you. Thank you. So we're just about to move into a private section now for item number 5.